Well, if difficulty hearing is cramping your style, you'll want to turn up the volume for our next guest. Dr. Christian Bish is an audiologist from Palmetto Audiology and Speech Therapy. She's joining us today to talk about hearing loss and also a lot of things that are involved that you and your office are doing to help out the local folks with maybe hearing disabilities. And I know some folks that just don't want to wear hearing aids because it makes them look older. And I'm talking about some relatives of mine. But to go and get the testing done these days, it's like testing has been done over the years. It's painless.
Easy and painless and pretty quick.
Tell us about that. Somebody needs to make an appointment. They're having trouble hearing. And what are some of the first signs that someone notices that they're having trouble hearing besides somebody going, did you hear what I said? Did you hear what I just told you? Besides that.
The main complaint that I get from patients is I hear, but I don't understand. They generally will say, I know someone's talking to me. I can hear my wife calling me or talking to me from the other room. I just can't pull that clarity out of what she is talking about. And many times that means they may have a high pitch hearing loss. They're only missing certain parts of that word, and it makes it hard to understand.
And that can happen so often that someone is saying a complete sentence and you're only picking up certain pieces because your hearing loss is taking out those other or not allowing the entire sentence to come in, correct?
Correct.
And does this start occurring at age 30, 40, 50? What normally would you see something like this?
We see it occurring at all different ages. Generally, we like to start looking at your 40s or 50s. If you're noticing a hearing loss or if your family is noticing a hearing loss, we'd love to see you come in and just get a screening done to see if it is affecting you.
And folks just need to give you a call there at the office for that, right?
Absolutely.
Yeah, and so when they come in, they sit down in what is called a soundproof booth. Similar to what you would see on a game show. You can't hear anything outside, but now you're starting to hear these very easy tones, and you just push a little, the lady right there, you can either raise your hands or push the little plunger button, and this is telling you what levels that you are hearing and what levels you're not hearing.
Right.
And how long does that test normally take?
It takes about maybe 15 or 20 minutes. It doesn't take long at all.
Yeah. Now you've got this really neat workshop that's coming up. Tell us about that.
This week, Tuesday, Wednesday, and Thursday, we have invited a professional from Starkey Hearing Aid Laboratories, which is one of the main player hearing aid labs in the United States today. She'll be in the office doing some demonstrations of some of their newer technology. So people can come in, have their hearing screened. If they're interested, they can come in and talk with Kristen about the new technology that's out there.
And a lot of these hearing aids are not the big bulky ones that we've seen years past. These are some ones that you're kidding me, you're wearing a hearing aid? I don't even see it. They're the same tone as the skin, and they fit very nice, and they're custom fit for the person's hearing or for the person's ear, but also custom fit to what the person needs to hear.
Absolutely. Yeah. We base our hearing aid fittings on lifestyle, and that's one of the things that I think our office and the audiologists that we have on staff do very, very well in our office. And that is going through lifestyle and making sure that you're fitting that patient with the correct technology for their needs.
Tell us about some of the new technologies that's come across your desk, your table, as an audiologist over the last several years and the last several months for that matter.
We have some very simple technology that you can use that is very seamless. There's no buttons, it's very automatic. So a lot of our patients like that. They put them in, you can't see them, they wear them all day, and they're seamless and easy. There is a new device that is made for the iPhone. So for some of our more techie patients that like to play with their iPhone and their iPad, they can actually FaceTime their grandchildren and hear the conversation through their iPad in their hearing aids.
Which is a huge thing because my mother did not know anything about that, and so my sister went over to the house recently and did FaceTime, and she goes, wow, when did that come about?
Right.
So the iPhone is helping out, especially some of our older generation.
Absolutely. I think my parents, my grandparents are learning more and more about FaceTime, and again, they're just learning recently, like, wow, I can see my grandchildren in South Carolina, and there they are on Mother's Day. So yeah.
Very good. Thank you so much, Doctor, for coming and seeing us today. Office is right there at 1801 Old Trolley Road, right there in the Somerville area. Give those folks a call, and again, they've got that special workshop coming up tomorrow, Wednesday, and Thursday. Thanks once again, Doctor. Now over to Tessa.